How important is getting more thigh muscle strength for healing knee arthritis? It is absolutely not that important. I would not focus on it. And here's 3 points for you to consider before finding more exercises to do for strengthening your thigh muscles. Number one is that the hip and the foot have more complex motions to manage than the knee joints. And so here's what I mean by this. If you strengthen your thigh muscles, these muscles most directly influence the knee joint. And really, the knee joint just bends and straightens. There's a few other tiny motions that happen, like there's little bits of rotation, but the big motion that happens in the knee joint is it bends and straightens. Whereas at the hip joint, the ball and socket joint, it can go up, it can go down this way, it can also move outwards, and there's quite a bit of rotation that happens at the hip joint. And the reason why it's so much more important, in my opinion, to strengthen the muscles up in the hip instead of the thigh is because this bone right here, the femur, the thigh bone, at the hip up here, it's the ball and socket joint, and it's all connected to the top part of the knee joint. So if you don't have good control of all those motions that I just mentioned up at the hip, then what happens is you lose control at the top part of the knee joint right here. The biggest problem that I see when it comes to controlling the hip joint is weakness in the glutes on the back side of the hip. If those glutes aren't very strong, then you're going to tend to not control rotation at the hip. And if rotation isn't well controlled at the hip, then it's going to mean that you're going to rotate excessively at the knee as you're bending. And when you bend your knee during normal activities, you have to be able to manage that little bit of rotation that's happening up at the thigh, or else you're going to put bad pressures through the knee joint. Same goes for the ankle. Now, the ankle does mainly move up and down like this, but there is some sideways motions. There's tons of muscles that help to stabilize the ankle joint. And if you don't have good strength in those muscles to keep your shin bone straight up and down, then there's a chance that your ankle can start to cave in, especially if you have weak muscles that hold up the arches. It's the toe flexors that usually help to hold up the arches. As you get those toe flexors stronger, then you're going to be able to better support your arches in normal everyday movements and then exercise movements. And that's going to help post your shin bone up so that it's not shifting your knee joint out of alignment. Because your knee joint needs to just bend and straighten in everyday activities, but it's depending on good alignment from down here in the ankle, good support and stability from the ankle, and good support and stability and alignment from the hip joint. The second point is that the quad muscles are more of a follower muscle and not a leader. What I mean by this is I'm responding to some of the questions I get, because I often tell people don't work out your quads, instead work out your glutes or the abs or the foot muscles. And people will say things like, well, the quads are important for stabilizing the knee joints. And I agree, but what I think those people are not seeing fully is that it's impossible not to work out your quads whenever you're doing exercises, most general activities. But if you focus, if you think about using your glutes more, then you're going to bias using the glutes, which is going to strengthen them. And inadvertently, by default, you're going to use your thigh muscles to do everyday activities like walking. So just take walking. Like I said, for example, if you think about using your glutes more intentionally while you walk, then you will probably tire out your glutes, assuming you can use the glutes and you have conscious control over them. But you're going to use your quads too. You're going to use your hamstrings as well. You're going to use your whole leg muscles. But the thigh muscles are going to follow suit. They're going to do what they're supposed to do if they're being led properly by the hip muscles, the glutes. So if you're using your glutes appropriately every time you walk, your thigh muscles are just going to do what they're supposed to do. They're going to follow. So the thigh muscles are followers, not leaders. If you flip it around, if you lead with your quad muscles, the glutes will do work, but then you're setting up more problems at the knee joint. And that's my third point that I want you to consider. If you focus on gaining more thigh strength, especially in the quads, when these quads get really strong, because of their attachments to the kneecap and then from the kneecap down to the shin bone, they're going to compress that joint too much. And if you're dominant in using your quads, if that's what you focus on, if that's what gets most tired whenever you're doing exercises, if you go on a walk and it's your quads that get most tired, it's just a matter of time before your knee starts to bother you. For some people, it happens right away. For some people, it might take a few months, but you'll start to hurt something. Maybe you get tendonitis, maybe you get a meniscus problem. Eventually, over the years, over the decades, you develop knee arthritis as a result of this. And people play this game of, well, it kind of hurts, so I rested, then it got better, and then I got back to the activity. Never thinking about which muscles to work on to fix the problem, and then it flares up again eventually as you increase the activity, as you get more intense in the walking or you do more of it, it comes back. And it's because the root muscle imbalance has not been addressed. And what needs to happen is you need to get more glute dominant. As you get stronger and you're using the glutes better up here, then you'll start to use the quads less, which will normalize the pressures at the knee joints. And that helps to keep your cartilage healthy. Cartilage is supposed to take compressive forces, but it has its thresholds. And if you're using your quads too much, then you're going to push the pressures in your cartilage beyond the threshold that it can take. And that's what begins to overcompress it, eventually injures it. And if that keeps happening for a long period of time, then you're going to tear it, wear it down, lose it, and put yourself in a situation where you might need a knee replacement. If you're looking for what to do instead of strengthening your thigh muscles, especially the quads, then check out this playlist right here about strengthening the glutes. That's the first best place to start. There's abs and foot muscles as well, but glutes is usually going to give you the biggest bang for your buck. So click there and check out the videos to help get your glutes stronger.